affected by cancer. If not yourself, someone you know, someone you love, someone you're related to or work with. There's a special group of nurses that are heroes at cancer, and they are oncology nurses. They provide chemotherapy infusions for cancer patients. Chemotherapy drugs are high-risk medications, requiring nurses to thoroughly review the regime ordered by a physician, required to question that regime if need be. They are required to do high-risk calculations, lost my place, and to question the rationale for what the medications are for. They conduct complex mathematical calculations to ensure that the blood tests meet the parameters for safe administration of chemotherapy. The medication, dosage, drip rate, and duration must be absolutely accurate. All of this takes preparation and time that is necessary for the safety check. I am not an oncology nurse. I'm here reading this because oncology nurses over on the 8th floor of the medical building on Geary and Divisadero are too busy taking care of their patients right now. They're too short-staffed to be here themselves to bring this important message. Further compounding the staffing shortage in the chemo infusion clinic, Kaiser management is refusing nursing demands to be assured sufficient prep time is provided at the beginning of their shifts to perform all of these safety checks. Rather, Kaiser is now requiring nurses to do these safety checks while performing other patient duties. This is not operationally feasible, and it will inevitably lead to compromise the safety of our cancer patients. Provided that Kaiser's vast monetary resources, there is no justifiable reason that Kaiser would intentionally understaff the clinic and create workflows that subject cancer patients to such avoidable risks. Let's keep our cancer patients safe.
Community leaders. We're very grateful. We are here. Why are we here? We are fed up. We are fed up with the way that Kaiser is prioritizing profits over patients.
Actually, I'm a patient.
Pardon?
I'm a patient.
You're a patient.
Yeah.
They are making their profits. Last year, 2016, they made $3.1 billion. First quarter of this year, they made $1.5 billion. We are having chronic staffing issues at the clinics, at home health hospice, at the call centers, in the hospitals. Okay? Who can relate with me?
Yeah.
You leave your shift. You feel frustrated. You feel defeated. Very disappointed in the type of care that you've delivered with your patients. I ask myself, did I deliver the type of care that my patients need and deserve?
No.
And most days, the answer is no. We are not going to stay silent in here.
Yeah.
This is the model of care that is failing our patients. And we are not accepting this. Our patients need and deserve more. So that's why we're here. We're here for whose patients?
Our patients!
Whose patients?
Our patients!
Is there any response from Kaiser to this charges here?
There's a list of them.
Respond to what's going on? I got your statement. Yeah,
I sent you.
yeah, I got it. I had questions about it.
That's the statement that I've been able to provide you.
Well, the question that they're raising is there are 500,000 additional patients here at Kaiser, and they say that there hasn't been additional staffing to take care of those patients.
I'm sorry, I gave the statement.
The statement doesn't say anything about the additional patients and lack of staffing.
Well, I'll check into that and see what I can find out.
Is that true?
I don't know.
Has there been an increase?
Check into that and see what I can find out.
So you don't know whether that's true or not.
I said I'll check into that.
Okay. Okay. Thanks.
I'm Mary Jo Moosney, a nurse in labor and delivery. I've worked at Kaiser for 39 years. We're here today to rally for safe staffing. That is the whole purpose of the rally, safe staffing.
And why isn't there safe staffing at Kaiser?
That's a good question. I think that question would be better directed to management who does the hiring. Basically, we want to feel that as a nurse in labor and delivery that the assignment we have is safe and that we have proper support to take care of our patients and we have rest times and break times so that, again, so that we can take proper care of our patients.
Isn't there state law as far as number of nurses on each patient, and wouldn't that protect the patients at Kaiser?
Not necessarily. There's also state laws about break times and rest times, and that doesn't always protect us because in reality we go missing our break times and rest times. As you will see in the letter that's being presented at this rally today, it's very clear that we often miss our breaks and rest times when the census goes up.
Is that legal?
Probably not.
Okay, my name is Pascal Wilburn. I'm a registered nurse here at Kaiser San Francisco.
And what's going on here today?
Today is our rally for about patient safe staffing. I can't get it out today. So we're here basically for Kaiser to come to the table and talk to us about our proposals that we put together for safe patient staffing.
And how long have you been without a contract?
We are still under contract. We had an extension to the end of this month. So we've started bargaining at the end of July.
And why isn't there safe staffing here at Kaiser in San Francisco?
Well, what's going on here at San Francisco and, well, Kaiser in general is there increases in profits and decreasing in patient care, where we've added probably 500,000 members to the Kaiser family as far as patients, but we're not increasing in the staffing. So what's happening is when you come to the hospital, you're downgraded as far as your level of care that you might need as soon as you come into the door, just because there may not be enough staffing in more of a critical care area. So that's one of our proposals that we brought forward, is to start bringing more nurses in, start going by the acuity system that we both agreed upon under Title 22.
Well, I thought this was a nonprofit operation.
It is a nonprofit, that's exactly right. So
why aren't they spending the additional money from the $500,000 on staffing?
That's our question exactly, and that's why we keep asking them.
So that's a lot of new members. And you're saying that the 500,000 additional people, there hasn't been any additional staffing?
Very little increase in staffing. Of course, they're meeting the state's requirements for ratios, but as far as specialty areas, the clinics, home health, hospice, these areas, and the call center actually, they're not increasing the staffing in those areas. So these members are calling into the call center to get appointments, but there's really no nurses there because of the influx in patients to handle the amount of calls they're getting.
So isn't this a violation of the law? Aren't they required to have proper staffing?
Yes, they are. And that's one of the reasons that we're holding them to this, and that's one of the reasons we're fighting for a GRASP system that we have here, the acuity system that we use at Kaiser San Francisco and Kaiser in Northern California. Kaiser has decided they want to change their acuity system to something called equity, and we want to be able, as the nurses, to be able to see what our acuity is of our patients. It's basically a ratio-based program. So if your patient needs extra time or extra care, we wouldn't be able to know that until we actually came on shift and started working, and by that time it's too late to try to get an extra staff member in to help.
And I mean, the executives of Kaiser, the management of Kaiser, they're making a lot of money. What do you think about that? I mean, there's a profit part of Kaiser, isn't there?
Oh yes, Kaiser has a profit area, and we believe they should just put their money where their mouth is, and they keep saying that we're thriving and we want to be here for our patients, and we want them to prove it.
And Kaiser and some of these HMOs have argued that under ACA they don't know what's going to happen and they have to cut back now. I mean, that's so they have to be prepared. What's your response to that?
This was the same argument they used in 2014 when the ACA was actually going into effect. That, oh my goodness, we're going into an ACA, we don't know how we're going to make profits. Kaiser's profit margin has probably doubled since we went into the ACA, so I don't think that argument's going to hold up with the public or with us this time.
And you say that patients, Kaiser members, then are really being shortchanged if there are 500,000 additional patients and yet no additional staff?
Absolutely. Yeah, the patients, as a patient, when you're sick, you're not thinking about, am I being taken care of correctly? You're just worried about being taken care of. And when you come into a system and someone of a physician or someone from administration is telling you, oh, well, you're not this sick, just go home and let your family take care of you. Well, that's not appropriate. That's what we're here for. That's what the nurses are here for. We're here for our patients, our community. This is where we live, and this is the people we want to take care of.
Now, Kaiser, along with one union, SEIU, UHW, has opposed the single payer. How would single payer affect it, and why is the CNA supporting single payer here in California?
CNA, I think, supports single payer because it's the right thing to do. Every person in America deserves health care, and with the profitability from the pharmaceutical companies and from the insurance companies, they could put that money into single payer with the government's assistance, and we could all have health care.
Kaiser has said in hearings that they wouldn't be able to do all the good things that they do for people if they're single payer. You don't believe that?
No, absolutely not. They might not be able to support the Warriors or the whatever they are in Sacramento, you know, their sports teams, but they could actually take care of their patients.
And how many nurses are there at this facility?
At this facility, we have a little over 1,000 nurses in this facility. We're doing rallies at the 22 facilities across Northern California and the one in Southern California. So we're about 19,000 strong.
So you're pretty confident you're going to get a good contract?
I think so. We may have to encourage them a little more, but I believe they'll come around.
And what about the other unions here at the facility?
Most of the unions with Kaiser are supportive of our proposals and supportive of the nurses.
Has there been a greater level of stress and health and safety problems from the nurses because of increased people using it and the lack of staffing?
Yeah, I think the nurses feel the stress from the patients because, you know, we want to make sure patients get good care. We don't want to hear call lights going off for 5-10 minutes. We don't want people waiting for us to come to give them pain medicine. So yeah, we feel the stress every day. Especially the nurses in the critical care areas where we're extremely short as far as, when I say short, I mean we have staff to take care of the patients that are here, but patients are being downgraded at a faster level that probably should stay in the ICU maybe another 24 hours, but they're being placed into a tele unit instead.
And some patients are being pushed out the door before they're properly...
Absolutely, yeah. We have patients all the time that are sent home for home care to take care of. Our home health nurses have been talking about this at the bargaining table. They're sent home and the home health nurses are having to go and do dressing changes that on wounds that should be in the hospital still under IV antibiotics. So they're having to refer them back to those of us in the clinic. I work in the clinic here at Kaiser, and our increase in patients is just unbelievable. We're seeing patients that actually should be in the hospital being treated, not in the clinic setting.
Wouldn't that be criminal?
It should
people
be.
Out before that
it should be. Absolutely, it should be. These people that are making these decisions, you know, I do believe they're breaking the law.
Because they have the money to keep the people in the hospital, but they really are...
Yeah, Kaiser is not a company that's hurting for money. They have the money to spend, they just don't want to spend it on the appropriate areas of care.
Hi, I'm Roxana Rodriguez. I'm one of your maternal child health nurses. Our staff has been very concerned with the short staffing that we have, that I'm going to read to you a letter that we put together here to Ron Groper, who's Kaiser San Francisco's Senior VP and Area Manager. The subject is Safe Staffing Now for Kaiser San Francisco Moms and Babies. Dear Mr. Groper, we are writing to you as very concerned and disappointed nurses in your MCH department. We have yet again reached a level of severe understaffing that is putting our mothers and babies at risk. We cannot afford yet another sentinel event in any of our departments. It is not fair for any mother or baby to suffer because Kaiser continues to put profits above safety. As we hope you are aware, last Sunday, September 3rd, our units were so starved of supplies and staff that we started the shift with patients who didn't have nurses. We had nurses performing vaginal deliveries without a second set of hands. Hands that are needed for the safety of our newborns and mothers, and also in case of emergencies. We also had a nurse performing a C-section by herself in the 4th floor operating room, where she was removed from the additional resources that could have been afforded had she been closer to labor and delivery. Ignoring the fact that our standard of care is to always have 2 RNs in a C-section. We have turned our backs on the local and national standards of care for MCH with the staffing Kaiser continues to provide our departments.
Yes, we have.
Every single nurse on every single unit in OB, antepartum, and labor and delivery missed their breaks and meals that day. Right. Not one single nurse got time to sit down, eat, go to the bathroom, or rest that day. And A&M was forced to take a full patient assignment in postpartum for the entirety of day shift to give every patient a nurse. And this is becoming commonplace in MCH. Nurses working overtime and without breaks are getting tired, and it shouldn't be their responsibility to fix the broken staffing by working 4, 10, or 20 hours of overtime every week. Safe staffing must become the norm and the basis for every shift, every day. Our core numbers have to be addressed. As they stand, they are too low and we still are unable to achieve them. Kaiser's just-in-time staffing model is failing our patients. While Kaiser generates record profits with our members' premiums, they continually fail to hire more staff to care for these members. We are calling on you to uphold the promise Kaiser made to MCH nurses over 6 months ago, where we were told 36 positions were being added to our departments. We must hire more local staff now to ensure the safety of our Kaiser moms and babies. Sincerely, Kaiser